Welcome. I'm Laura Siminoff. I'm the Dean of the Temple University College of Public Health, and joining me today are our faculty experts, Graciela, Jaschek, Sarah Bass, Krys Johnson, Heather Murphy. We'll be discussing some of the evolving issues and also offering some very practical guidance today. So, Graciela, I know we've talked a lot about who is at risk. So what I'd like to do is talk more specifically about two groups, African Americans, Latinos, and younger 20-somethings. First, let's talk about African Americans and Latinos and why they seem to be disproportionately affected, including a higher death rate.
Yeah, well, everybody is at risk of being infected with COVID-19, but some groups are at higher risk of getting infected, having serious disease, or dying. African Americans, Latinos, and the poor often experience social conditions that carry risks for them, and these conditions are not of their own choice. What puts these individuals at higher risk is being part of the essential workforce that includes low-wage, high-risk jobs such as grocery store workers, workers in food processing plants, bus drivers, or facility cleaners. Other risks that often cannot be avoided are using public transportation to go to work, living in crowded conditions, having less access to information from the internet and social media, having less access to equitable healthcare, and experiencing language barriers or discrimination.
Mm-hmm. So let's look at the opposite end of the spectrum. Seemingly young, healthy people, especially affluent young people. I see them walking around when the weather is good, they don't social distance, they don't wear a mask. Is this a problem? If they are less likely to get very sick from COVID-19, I think they say to themselves, well, why shouldn't I do this? What's the problem?
Oh, it is a huge problem. Anyone who does not take precautions, regardless of their age or economic status, is at risk of becoming infected and in turn spreading the virus by infecting others. That is the whole point, not infecting others. Practicing social distancing, washing hands, wearing face masks in public are some of the most important ways to protect yourself, but mostly you do it to protect others. If you are young and infected with COVID-19, you may experience mild symptoms or feel no symptoms at all, but you're still carrying the virus and spreading it. So this is a defining opportunity in your life as a young person. Choose not to be the spreader who brought this dangerous disease to your parents, all the relatives, or anyone around you. Choose to take precautions for the sake of others.
Right. And would you also say that a lot of people they're not even aware that they're positive. None of us know whether we are positive or negative in reality.
Yeah. So essentially, you may be carrying the virus, not experience symptoms, or they are mild, but you are still spreading the virus. And if you are not tested, you don't know that. So that's why you need to choose to take precautions. And it's not just for yourself, it's for everybody else.
Thank you. So Krys, the symptoms of COVID-19 were actually recently expanded, and the CDC came out with some new information. Can you review the symptoms and discuss when you should consider getting tested, and if you have COVID-19, when you should actually seek help and go to a hospital?
Sure. So with COVID-19, we've known from the beginning that we expect to see a fever, shortness of breath or difficulty breathing, also a cough, which could be dry or wet depending on who you are. But the symptoms that were added include chills, shaking with chills, muscle pain, headache, sore throat, and a pretty odd one for most people, a new loss of taste or smell. So all of those can be indications that you have COVID. And most of those will be pretty mild. Fever can spike pretty high, but with Tylenol and taking care, you could be fine at home. So if you have minor symptoms, current guidance is to just take care of yourself at home as best you can, staying away from your family as much as possible to make sure that they don't become infected. But you can also, that can turn into trouble breathing, persistent pain or pressure in your chest, or actually an inability to wake up because you're getting so little oxygen to your body. And with people of lighter skin tones, that can also turn into a bluish tint of the lips or the face. So if you start experiencing more severe symptoms like that, then you should make sure to seek medical attention immediately. And like I said, that bluish tint isn't really going to show up so much for people of darker skin tones. So with people of that complexion, make sure that you're focusing more on the trouble breathing or persistent pain in the chest or inability to breathe.
Okay. So Heather, along with recognition of all these other symptoms, I think we're also learning that there are many other consequences of being infected with COVID-19 than just your lungs. And I think that I keep reading new stories about this, including a story I just read, I don't know if you saw it, about children and some sort of syndrome that is going on with them in New York City. So can you explain a little more about it? And is it correct that coronavirus causes things other than having lung problems?
Yes, Laura. The coronavirus can cause lots of different complications now. So the main complications are related to your lungs. So you can have acute respiratory failure, which basically your lungs can't pump enough oxygen into your blood or cannot take out the CO2. You can have pneumonia, or you can also have acute respiratory distress syndrome. But the other complications that are coming out more in the literature now of people who have been hospitalized are liver failure, so acute liver injury. And we don't really know why that's happening. That's still unknown. It could be caused by the virus or as a complication. There's also heart complications, so acute cardiac injury, heart problems such as arrhythmias, so changes in the beating of your heart. It's not clear if the heart actually is attacked by the virus or if it's just the illness is stressing the body so much. And there's also been cases of stroke reported in really young people, which is quite concerning. There's also acute kidney injury. This isn't common, but it's serious if it happens and it requires people to have dialysis. And also we're seeing unusual blood clots forming, causing internal bleeding and organ failure. So those are some other new, I guess, complications that are coming out of the disease. And I think more and more complications are going to be seen in the near future.
Right, so all the reason for people who are young to say themselves, well, I may be at less risk for having this, but you know, who wants to take the chance of having a stroke when they're young, right?
Yeah, exactly.
So Sarah, could you talk a little bit about some of the issues that are popping up around COVID-19? So obviously there's a lot of discussion that we're seeing excess mortality in the United States. Some of this may be due to undercounting cases of people dying from COVID-19 because we're not getting tested, but maybe some of this excess mortality may be due to the fact that people aren't getting their regular care, say for diabetes or heart disease or cancer. And so could you talk a little bit about that, and what should people who need to get more regular care be doing? Should they be scared to go and see their regular health care? Should they be scared to get their normal blood draws? Is there anything you can offer to them about how they can navigate their own regular health needs during this period of time?
Sure. I think, you know, the interesting thing is COVID-19 has certainly consumed our thinking for the last 2 months, but everyday health issues are still occurring. And there are a number of hospitals that are reporting that people with other things, either chronic diseases like diabetes or acute things like even having a heart attack, are not, that the folks who have those are not going to the emergency room or seeking doctor's advice for fear of contracting COVID-19. And you certainly can understand that when we're hearing so much about the deaths and the illnesses like Heather was saying that the virus is causing. There are a few things I think that people can do to safely seek treatment if they need it. So I think the first thing would be, you know, definitely to call a doctor's office if you're experiencing anything minor, so minor illness or an injury. So if you fall and cut your lip or you have a stomach bug, for example, they can kind of help figure out if you need to come in or if you can do a virtual visit over video or on the phone. I think another important thing is if you have a chronic illness that requires medication, you could ask the doctor for a 60 or 90-day prescription to have delivered to your house so that you don't have to go in to have a new prescription written. If you do have to go see the doctor in person, be sure to practice, all the things that we've talked about: social distancing, not touching your face, using hand sanitizer, etc. And also know that the doctor's offices and the hospital are doing things to protect you as well. So, cleaning and disinfecting surfaces frequently and trying to minimize kind of physical contact between them and you, and then between you and other patients. I know my husband went to the doctor last week, and the doctor came in to see him just for a minute and then left and got his cell phone number and called him to go through the intake questions. So rather than being in the room for him for 10 minutes. I think, importantly, if you have something more serious like a broken bone or you have chest pain or severe allergic reaction, go to the emergency room. They are equipped to protect themselves and you, and do have procedures put in place to come and keep people separated. So don't delay emergency care. And then the final thing I would say is just to take care of yourself. Eat well, exercise if you can, go for a walk, stay socially connected as much as possible virtually, and take your prescribed medications because you want to do the most you can to avoid going to the doctor.
So let me just follow up on one thing. So some people have scheduled screening tests, their annual mammogram, a colonoscopy, which, we highly recommend for people. What would you suggest they do right now? Should they go get their regular mammogram, colonoscopy, or should they reschedule for a later date?
I think that's a discussion they should have with their doctor about whether or not it's something that they really need at this particular time, because they do want to minimize as much of the risk as you can and coming in contact with others. So I think that discussion is really important about, is this mammogram something that we can put off for a couple of months, or should we do it today?
Okay, that's great advice. So finally, Heather, I know you're recording a video of how to use a mask, and we've all been told when we go outside, we should wear a mask. And certainly, if we go into public places, we should also be wearing a mask. Can you just run through the do's and don'ts for everybody?
Sure, Laura. I think one of the most important things is here, I've got a couple masks with me, one that's tie on and then one that's got loops. The important thing is to not touch the outside of your mask. And if you think of it as when you're wearing that mask, the outside could be covered in coronavirus. And I don't think people realize that, because that mask is protecting you potentially from contracting coronavirus, but also protecting you from giving it to someone else. So when you put it on, don't touch the front of it. Put it on over your ears, and then try and adjust it as much as possible without touching directly on the front of the mask. When it's on, do not do this. I walk around town and everyone's like this, even doctors and nurses. You are not supposed to do that. You take it off, you use like a loop, and you just take off one side of it if you have to take a sip of water or something, and then you put it back on. Do not wear it like this. You breathe through your nose. So many people are wearing it without covering their nose. You need to cover your mouth and nose. You want to make sure it fits snugly on your face as much as possible. So I have a small face, so I also have these ones that you can tie on and fit right to your face, and for small children as well. And just really don't touch it. And then if it's a cloth mask, I would recommend washing them after every use, or at least daily. If it's one of those surgical masks, they really shouldn't be reused. So you use it once a day, and then you should throw them out. So don't reuse them. So that's a quick rundown on masks.
Okay, great. And do you suggest that children wear masks as well? I see very, very few children wearing masks.
That's a really good question, Laura. I have masks for my kids. It's really hard to get small children to wear a mask. I think you wouldn't put one on an infant or maybe a toddler because it could restrict their breathing. I think that's really challenging. Small children, if they can tolerate it, I make my kids wear them if we're walking down the street and we're going to be near anybody. If we're in an open park and we're social distance enough, I'll let them take them off to play and run around. But I think if your child can tolerate it, I think you should put it on. But at the same time, as a parent, it's really hard to force a small child to wear a mask. So as long as parents are being respectful and keeping their children away from others, like, I think that's not horrible.
Okay. All right. Well, thanks for joining us today to hear last week's panel. View Heather's demonstration that we'll be putting up about wearing a mask and other videos and links to reliable information. Please visit cph.temple.edu/coronavirus.